Furosemide is a diuretic medication commonly used to treat various conditions, including 1. Edema. Furosemide is often prescribed to help reduce excess fluid buildup in the body, particularly in conditions such as heart failure, liver cirrhosis, and kidney disorders. 2. Hypertension. Furosemide may be used in the management of high blood pressure hypertension when other antihypertensive medications are not sufficient on their own. 3. Acute pulmonary edema. Furosemide can aid in the treatment of acute pulmonary edema, a life-threatening condition characterized by fluid accumulation in the lungs. 4. Chronic kidney disease. Furosemide may be used in patients with chronic kidney disease to help manage fluid overload and associated complications. 5. Hypercalcemia. In certain cases, furosemide may be utilized to help lower elevated levels of calcium in the blood. It is essential to follow your healthcare provider's recommendations regarding the appropriate use of furosemide and to discuss any questions or concerns you may have about its indications and potential benefits in your specific medical situation. Write your questions in comments.